engineering and a heart transplant recipient, and Ms. ICrite, who is the Director of Continuity Home Health Care, which is housed at Matthew Walker Health Care Center. And let me welcome both of you to Black Pulse.
Thank you.
Mr. Love, you are a heart transplant recipient. Perhaps you'd like to give us as much personal information as you would like to in reference to that fact.
Okay, well, Dr. Haney, first of all, I was in perfect health. And I was just going about my life. And well, one day I was mowing my yard. And I was just mowing the yard, and all of a sudden I had something seemed like a blowout in my chest. It seemed like all the air just rushed out, and I started to get tired. And so it went on for a couple of weeks. Every day I got tighter and tighter, and got to the point that I couldn't sleep at nights. And so I finally got to the point my wife got tired of it, and she took me to the hospital. And so they x-rayed my chest, and the doctor, after they analyzed the x-rays, he called me at home. He sent me home. He called me home and said, I want you to come back to the hospital. And after he got me back, he talked to me, and he said, I think you're going to need a heart transplant because your heart is, you know, it's real big. It was all in my stomach and all.
It was an enlarged heart?
It was enlarged at the time. And so they did a lot of tests and all. They couldn't figure out exactly what was causing it. And then they came up with the term cardiomyopathy, because I had no previous history of this and hadn't been, you know, sick in anything. And so they told me that a virus attacked my heart and ate up the muscle. And by this time, you know, I was constantly getting weak and losing weight, and my body was retaining fluid.
How many months was this after you had first experienced the first attack?
This was about a month afterwards, you know. And like I said, after I got the information, I just kept going downhill. My body would start retaining fluid, and they kept me on Lasix, so, you know, keep the fluid off my body. And I was losing weight. And I'd been to 2 or 3 different hospitals in town here, and they couldn't do anything for it, so I was put on the list for a heart transplant. And this was eventually at St. Thomas Hospital. Very good.
Let me say something in reference to cardiovascular diseases. Now, the problem that he's talking about, Ms. Crite, has very little to do with this health report that we are dealing with here. Is that correct?
He was fortunate in a way that the virus attacked his heart. He was in good, perfect health prior to having the attack. Unfortunately, some of our other blacks are not in good health. They are diabetics, or they have hypertension or cardiovascular diseases. They're predisposed to other illnesses prior to having a problem such as he had.
And in that instance, lifestyle, I would imagine, would play a very important part.
Our lifestyle plays a very important part. In a study done from 1920 to 1977, we found that 40% of the blacks over whites, male over female, have hypertension at a greater risk and die of it than the white population. In Africa, where one study was done, it was found that they too, because of the lifestyle and the socioeconomic changes there, are beginning to attack the black population. Our eating habits, our high cholesterol levels. Stress factors have a little to do with it, because there are people who are very relaxed. They too have hypertension. Children in the black race are up until the age of 19, there's no difference. At least in the last study, there wasn't a difference, allowing for weight. Now, weight differences do cause a problem. It seems to be from the age of 30 to 50, or 35 in a male to 50, that they have a problem with hypertension.
So hypertension is really a problem of middle-aged black men more than younger children. Is that?
That's true. And women, black women as well. The men and the women equal out at around age 55. It is a disease, however. If noted in time, that can be managed with medication. Diet is real important. Our weight problem is one of our major causes of death.
Is there some specific food that creates a problem in terms of diet? A group of foods, or what?
I guess you could say there are groups of foods. There is salt, which is sodium, which causes the volume to increase, the blood volume to increase. It causes a tension on the vessel, which eventually, anything, if you put stress on it, eventually will blow. And that's essentially what happens. In the arm and in the leg, the vessels can stretch a little and there's room. But when it gets to the back of the brain, when they stretch, they usually go out, which then we have what we call a cerebral vascular accident or stroke in lay terms. Weight plays a big part. When you gain weight, for every pound, you have to put 35 miles of vessel in, and the heart has to pump harder to feed that tissue, and that creates a problem. Arteriosclerosis is the vessel that fills up with plaque, and it's sort of like a hose. If the hose filled up with debris on both sides and it was open-ended, you'd get a trickle. But if the hose was closed, it would expand it, and eventually you have blowout in the hose. Same with the body.
Very good. As a final question, you would like to say something about organ donations, and I would imagine that you would be the perfect man to say something, Mr. Love. What would you like to say about organ donations?
Well, Dr. Haney, I would like to say that I think it's very important that people realize the importance of organ donation, especially in the black population, because we do die young and of many different causes. And that way, for that reason, there are a lot of organs that are being, just being buried and nothing done with them. And there are a lot of people that are in hospitals that can be saved if people would sit down and have the time, even at the dinner time where they're eating, would discuss, well, if I die early, why don't you, donate some of my organs? Because there's other lives out there that could be saved, because, there's so many organs you can donate to help people, corneas, hearts, livers. And I think that people should start considering this and not just bury these good organs.
Very good. Let me thank you and the other members of the panel for coming by and talking to us about this very, very important topic today. And let me invite you to tune in again next week for another informative edition of the Black Pulse of Nashville.